Hey, Joshua Cruz here. And after talking a little bit with someone on Facebook who apparently liked one of my videos, it had helped them because of some personal issues they had had. Well, long story short, it made me want to target more the different, I guess, symptoms or just some of the symptoms that go along with schizophrenia. One of the ones I want to talk about in this video is basically about disorganized thinking, really. There's probably a fancy name for it, but long story short, and you probably noticed this in some of my videos, I ramble, connections aren't always most apparent with some things I say. Not saying they're not there, but they're a little bit looser than I would like. Well, to make a long story short, with schizophrenia, there is a disorganized bit of a mess to the mind. Now, depending on each person, it's different. Some more severe, some are not. For me, I'm not saying like I'm another mess, but people with schizophrenia, they tend to make different connections that the average person wouldn't make. In my case, I might see something and it might be clever, the connection I make, or it could be utterly nonsense. You think cat, someone says dog, well, they're both pets, okay? But someone's talking about their dog, telling stories and about dog behavior, and then suddenly someone mentions something about cat behavior. No connection. That kind of goes along with schizophrenia. It can manifest itself in many different ways, as far as, well, basically a person with schizophrenia can be talking, and if you listen to everything they're saying, you might go, this is complete rubbish, utter nonsense. There are fully formed words, big words, small words, all kinds of words, but no connection. It's like a stream of just white noise. Nothing makes sense. So, to get to my point, disorganized thinking, as one health website I've read, and I've read quite a few, mentioned, they call it the disorganized dimension. And this really shows up in speech patterns more than anything. It is thinking, but you'll notice how sometimes the words start getting a little mixed up when someone with schizophrenia talks. That tends to go along with it. Now, this is not a logia, which refers to difficulty with speaking, which, as this website states, in some schizophrenic patients, a logia manifests as reduced total speech output and reduced verbal fluency, the ease with which words are chosen. Patients displaying a logia struggle to give brief answers to questions, for example. That is not the disorganized thinking or speech that I'm talking about. Now, it certainly probably doesn't make it easier for someone with schizophrenia. But this is disorganized speech, this disorganized approach to the mind. You might, in the right dose, it's making all kinds of clever connections. You see things from angles that people normally don't see it from. Take it too far, though, everything is relevant. And if everything is relevant, nothing's relevant. And the reason I decided to bring this up is people try to understand sometimes what other people go through. Try to walk in another person's shoes, so to speak. And that's a little hard to do for someone that has schizophrenia. A parent, a loved one, a friend, a girlfriend, boyfriend, whatever, can try, but there are just some things they may not understand. And it's not that they want to be disorganized, it's not that they're trying to say things that don't make sense. It's just the way they are. Most medicines that treat schizophrenia do not properly really treat negative symptoms. So you could take care of all the positive symptoms, meaning no hallucinations, no voices, no seeing anything, no paranoia. Negative symptoms tend to remain. Now, some medicines deal for some people better than the others when dealing with negative symptoms, but there's really no good medicine out there that deals with both positive and negative symptoms. So, for people trying to understand someone with schizophrenia may not even really understand themselves. They may not get why their mind makes these connections, and it's incredibly frustrating sometimes. It's incredibly frustrating to feel like that odd person who thinks they're being clever, whether it's in class, in church, wherever it may be. You think you're being smart, observant, you say something, and people look at you like you're crazy. No pun intended here. I'll probably do a more in-depth video about this, trying to bring more relevant facts up, put links to different websites in the video. But I wanted to talk about this as far as more my experience, and just give a general brief description of it. Now, I think I'm more on point with what I'm saying, but if you watch my videos, you'll notice there's a bit of a rambling, disorganized approach to them. Even the most organized ones tend to have me making some odd connections. And the best you can do if you're looking for my advice about how do you help someone with schizophrenia with that is you help them, you try and understand. Eventually there's a pattern probably will emerge in how they make connections, but you help keep them on track, you help talk to them. That's about the most you can do. So thank you for watching. If you liked the video, click the like button, subscribe, share, and comment if you want. Thanks for watching.